There seems to be growing fear that the widely damaging impact of the COVID-19 pandemic and the global race to contain it may be taking crucial attention away from the dangers of well-known tropical diseases. Medical experts say for this delicate situation to be properly managed, the World Health Organization, medical research institutes, donors, and the drug companies must not give room for any form of breach in information dissemination, supply, advocacy, and continuous research and development of all processes geared towards sustaining attention on areas of the world that are most susceptible to these diseases. We are now being joined by Dr. Joseph Onigbinde, an infectious diseases specialist and executive medical director, Roheka Medical and Dental Hospital, Lagos. Good morning, Dr. Onigbinde, and thank you for joining us. Good morning.
Good morning, Dr. Bati.
Yes, good morning. Good to have you on the
it's
program.
Doctor versus doctor now.
Quickly, Dr. Onigbinde, the major concern, not just in Nigeria, but also internationally, is that in the times of COVID-19, certain diseases are being forgotten. Some people are not even paying attention to basic tropical diseases. How much of a serious concern is this in Nigeria, for example? And what are those infectious diseases that we may have overlooked while focusing on COVID-19?
Thank you very much. You already underlined the issue that although most people are now talking about COVID-19, which should be actually, but a lot of underlying problems we always had are these tropical diseases. And it's a very, very serious case in the sense that that was our problem before in Africa and all these other poor nations. Over 149 nations of the world are suffering from these tropical diseases, but most of them are neglected because the people that are actually affected are the poor nations of the world. So those who are doing research are mainly the rich nations. And this is unfortunate because in Nigeria especially, we are still suffering from, we are still battling from a lot of these tropical diseases, such as Lassa fever, Ebola, well, we don't have Ebola now, but other tuberculosis and other viral infections and infestations by parasite, malaria inclusive. This is a very serious problem. In fact, initially, those are the problems with Africa and other this tropical region. Before you have the recent epidemiological transition, where we now have double burden of disease because you have communicable disease now, non-communicable are coming to compound it. This is something that should actually concern everybody. Concern in the sense that the people who have the money are not really seriously infected, and that's why we say they are neglected diseases. And those of us who are affected in this part of the world, we are not really doing any research. It's unfortunate that tropical diseases are as many as they are or as numerous as they are still being neglected in this area of the world. I have the opportunity of attending one of the best tropical institutes in the world in 1990. You will see that this was a very small, in terms of structures, not really big, not up to 1/3 of Luth. But the type of research that they have every day was more than what you have years in Africa. And this is very sad.
It is very sad indeed. What should be done about that to boost our research capabilities? It's often described as a funding problem, but is there more to it than just a funding issue? And I also wanted you to address the fact that, yes, while we have COVID casualties, as you've said, we're facing other outbreaks in Nigeria at the moment. What are those outbreaks and what is being done to control the casualty rates?
Well, let's talk about the funding issue. I did a study in 2012, a doctoral study about the funding in the past 10 years in Nigeria and the health performance. It was so sad that only 2007, we had funding that was as high as 7% of our total budget, whereas We should not, in some nations we have up to 15, 20%, but in this nation, it's as low as 3% as we are talking about now, So funding must be improved. Funding must be improved for health services for us to have any meaningful result, any meaningful health gains. That is that, and we can't overemphasize that we are not doing health funding in Nigeria, and that is why we're having very poor performance. I will appeal to our government and individuals, especially those who are very rich in the society. They should divert their attention to at least help us develop our health institution, particularly primary health care. Primary health care, most of these problems we're talking about, these tropical diseases, are mainly the problems of primary health care. If we have a very solid primary health care development, we will not be talking so much like this. I remember in 1984, 85, where we had a very vibrant health minister, Professor Olikoye Ransom Kuti, that primary health care was, it was very, it was right in the front burner. But we don't even have such of that. Another person that did that, you may hate him, is Obasanjo. When he was president, he had a health minister that actually addressed the primary health care, and that was why we had such good performance in our health sector. So we have to appeal to our government and individuals, non-government organizations, to please focus on these tropical diseases that are really battling us. Like you said, we already have some outbreaks, like yellow fever. We are aware that you have yellow fever problem in the country, which is a viral infection, and it is very sad that we are not really addressing, and the Lassa fever has always been with us. Incidentally, Lassa fever was discovered in Nigeria, in Lassa village in the north. But up to now, we don't have a vaccine for you. You don't have control for it, and this is not good. Another problem that affects all these tropical diseases because of poor environmental health. Our environments are not developed. Our environments are most of these diseases are like cholera. They are waterborne, and even tuberculosis, for instance, meningitis, where you have poor accommodation. And so these are the things that we should actually address. You develop the environment. Environmental health is very, very crucial. Without it, there is very little to do, we can do about these tropical infections. It is true, it is good for us to face COVID, because COVID is killing in thousands, but we are lucky in this part of the world that COVID is not as ravagous as in America. In fact, the whole of the death mortality in the whole of Africa is not even up to 10% of what we have in America alone. We thank God for that. And I want to say, one of the reasons why we have low mortality in Africa with COVID infection is because of our system has actually developed some resistance or some antibodies against COVID infection. So in a way, we are benefiting from this tropical disease that have been afflicting us over the years. Nevertheless, we have to do something. I want to suggest that maybe I think it is time that we restructure our medical training in our medical institutions. When we were in school, we only had a few hours, now if you maybe 6 weeks of training in preventive medicine, where you talk about all these tropical diseases. I think it is time we refocus our attention and really study this. In fact, I'm surprised that we don't even have tropical institutes. We have tropical institutes in Europe and in America, and these are the infections that are affecting us. We should have at least 2 in Nigeria, tropical institutes, that people will just face these tropical diseases and then do research. We'll be able to come out with solutions with this. So with all this, without facing all this, without doing research, without having our studies, I think it is a waste of time, and we'll continue to suffer for this for a long time.
I mean, you made a very, very great analysis of the issue. Thank you so much for that, Doctor. In fact, it's shocking that since I think it was Dr. Piot, the Belgian doctor, in the 60s at the London Institute of Tropical Medicine, did work on Ebola. We don't still have a vaccine on Ebola. I mean, we just keep hearing about ZMAP and the likes, but we don't still have a vaccine on Ebola. And myriads of other challenges like that we have. Since we started having cholera outbreaks way back in the 1930s and 40s in Nigeria, till date, we've not named cholera on the board. Should we think of sort of like an African solution now, or maybe like a regional solution? Is there a possibility we can gather ourselves in the ECOWAS unit and say, okay, even if it's 2 tropical disease research centers, maybe put one in Nigeria and one other Francophone African country in ECOWAS, that where we can dedicate some very good money from ECOWAS budget every year, just to research and get something out to be able to fight this disease. Because it's obvious the West is not coming to fight this for us. Why we're all talking vaccines now for COVID is because it affects the West. Ebola, they didn't wake up that much because it didn't affect them.
You are right. You are right. And I think I tried to underline that statement earlier on. It is time. I think that is the way to go. We don't have to wait on the world is a global community now, but we don't have to wait on international community to help us out, because these things affect us directly. And like you said, incidentally, Professor Peter Piot was my teacher when at the Tropical Institute in Antwerp. We had always been saying that, what are you people doing in Africa? What are you people doing? But at the when HIV came on board, one of those days I went to the institute and I was talking with him and was saying, there's a virologist in Nigeria, Wale Tomori, that what are you people doing? By now you should be categorizing the HIV according to regions. But we are doing nothing. I said, well, in our country, most of the professors and doctors are still trying to put ends made to do. They are still trying to put the soul and body together. Because it is very sad to hear that some health institutions or doctors are not even paid their own salaries for up to 9 months, 10 months. So when somebody has not eaten, why will we be thinking of doing research? Like I said, where I studied, it was a very small area, but the type of research that are coming out. In fact, there was a particular professor, Professor Jigas, who was in his 70s. Professor Jigas was still dissecting mosquitoes to look for solutions for malaria. And where we are affected here in Nigeria, nobody is talking about that. I don't think we can overemphasize this issue. Let us talk to our government and individuals to put things together. And we have mentioned that at least you have some tropical institutes in Africa, even if it's just, let's start with West Africa. Let's say Nigeria alone cannot carry it, which I think Nigeria can do anyway if we are very serious. But let's have tropical institute where you have research, vaccines, and everything which will come out. But if you have to wait on the outside world, unless they are seriously affected, like in COVID now, where they are, see that COVID vaccine is already almost coming out now because they are seriously affected. But look at Lassa fever they've had over the years. No, nothing about it. So I think it is time we Africans actually held our situation by ourselves. Let's not depend on outside world. We can't overemphasize this issue.
Well, in the context of all the things you said this morning, I'd like you, Doctor, to react to a recent story that we took, which is the news of a Nigerian trained doctor being part of the team that came up with the Pfizer vaccine. And that's Dr. Onyema. I said Pfizer, the COVID Pfizer vaccine, which is, and the person in this regard is Dr. Onyema Ubuago, trained here in Nigeria, and has been doing wonderful things abroad. How significant is that to you in the context of all the things you said about having research?
This is very significant. This is what we are saying. This is what we have been saying. Our boys, when they get out, boys and girls, when they get out of this environment, they do extremely well. They do extremely well. And it's not because they are being paid regularly, but the enabling environment is created there. No, there was a time I was asked this question that we understand that many doctors in Nigeria are doing well in America and all that. Why can't they come home? Is it because of the salary that is so bad? I said, no. Even they want to come home, You don't have electricity, you don't have water. There was a year I went to Lagos University Teaching Hospital where I trained, and they were supposed to be in the theater, and I saw the boys, just talking, just looking around. I said, are you guys not operating today? They said, no, there's no water, there's no diesel. I said, what of the patients that have to be operated? They said, well, that is if they can find diesel, they will work. Otherwise, this is very serious. Nigerians outside are doing extremely well because the environment is very conducive. That Dr. Onyema has brought some glory to Nigeria, and I hope nobody, federal government will not want to claim that it is the American system that has actually enabled him to do such. We have so many that I can list. I have even personally, I have children that are doctors who are not even interested in coming to this country, and they are doing well over there. So if we can appeal to our people, our politicians, our governors, our president, to please earmark minimum of funding, because you can't have health performance if you don't have adequate funding.
Indeed, that is such a shocking anecdote you just related. Just give me a second to process that. Not having diesel and not being able to perform your, but I mean, imagine. I need a minute. I'm completely gobsmacked, I have to say. But I wanted to ask you about the latest news coming from the AstraZeneca vaccine, which many in Africa had thought would be our best bet as an investment, since it's only $3 in comparison to the more expensive models that are out there now. And obviously the logistics as well are more favorable to us. But now they've been forced to admit a dosing error where some of the participants in the vaccine trials were given half of the dosage. What is your take on this? Is this discouraging, or is it just a minor blip?
No, this is not a minor blip. This is very encouraging. And as a Zeneca, we still need to wait for a few other information to come out. But for now, I think those 3 vaccines that are in the pipeline are very, they are encouraging, and I think we should embrace it, especially the one that favors us in terms of temperature. You don't have to go to minus 30 degrees to be able to keep it. I think this is encouraging, and we also should also. I think I will be happier if we have such development in Africa. Let's say a vaccine for COVID is emanating from Egypt, for instance, or from Nigeria. It will be more encouraging. But being that as it may, I think we should still clap for AstraZeneca and Pfizer. And there are a lot of conspiracy theories around that the vaccines are actually meant to kill people, they are to reduce the population of the world. I don't think so. These are conspiracy theories that are very, very fallacious. I think we should we should applaud those 3 organizations, Moderna and AstraZeneca and Pfizer.
Right, great one there. In all of this, most of these tropical illnesses, like you stated, are caused by hygiene issues. And Nigeria is the capital of open defecation in the world. I think we've been able to conveniently overtake India as the capital for open defecation in the world, which is a cardinal point in things like cholera and some other illnesses. How do we solve this challenge of hygiene and open defecation?
Well, I have said a few things, a few suggestions about the governments and individuals, but I think individuals themselves, we also have to up our hygiene status. And that is very, very important, very, very important. You see people going on the road and there was a story of one governor at a time who was just urinating by the roadside. This is very sad. And education, I also say, is very, very important. Health education is not outside there. In the developed world, in fact, some private individuals have more information than even medical practitioners, because the public health is always giving out information every time. And this is what we should do. We have to cultivate our community. Open defecation is bad. Just coughing anyhow is bad. Just urinating anyhow is bad. And like in those days, our parents used to use something, and it's health education. They'll tell you, don't use your hand to draw line on the floor. Otherwise, if an ant enters into it, your mother will die. Everybody will be afraid to do such a thing. So if you have something like that, and I think I also want to say, maybe we should also have this wole of a thing, this health, what do you call them?
Health inspectors.
Health inspectors. Health inspector, where they bring punishment to people who are not obeying simple health instructions. So I think everybody's hand must be on deck, both the government and individuals too. Well, that is my take on that.
Well, Doctor, on COVID-19, the ECOWAS has a body that is focusing on that, and then you also have the African Center for Disease Control that is focusing on that. Now, the Africa Health Strategy 2016 to 2030 talks about neglected tropical diseases and how those can be, addressed at a continental level as part of the preparation for Agenda 2063. How effective do you think, bodies like ECOWAS, African Union, and others could be in addressing these neglected tropical diseases?
No, I think that is what we have been talking about. If what you have just said now, they are on paper, but if they should put this into action, then I think it will be wonderful. It will be wonderful. We don't have to wait for that. The African countries can come together and tackle neglected tropical disease. They are neglected because the people that are giving us money, that are doing the research, are not seriously affected. This thing affects mainly African countries, Asians, and South America. But if Africans can come together and do something very positive about it, I think we'll be out of the woods in no time.
No, but what do you think in terms of...
But what you are saying, it is on paper is good, but I hope they will put action, they put the action into this, their speaking, to their speech.
Well, but there are real difficulties, and I don't know whether you like to talk about those difficulties. These countries, if you look at the league table with regard to neglected tropical diseases, they have various levels of financial capability. And you know that in Africa, if you ask for collaboration, most of these other countries may not be able to deploy resources. And then you'll find African countries becoming over-dependent, either on the Global Fund or on WHO.
Yes. Two issues. Number one, the issue of politics and bad leadership. It is true many African countries are very, very poor, but mismanagement of funds and is one of the bane of African nations. For instance, Congo, Brazzaville, Congo, Kinshasa, these are very, very wealthy nations. They have natural resources that even America and Canada and all those, they don't even have. But the leadership we've had in Africa is next to nothing. We are very selfish leaders who just keep on amassing billions of dollars, with the money that cannot spend in their generation. Even they are going to live for 200 years, they cannot spend. But yet, because of avarice, they gather this in and refuse to deploy resources where resources are needed. So bad leadership is one of the problems. It's in fact it's the greatest problem we have in Africa. Don't say we are poor because we don't have good management. Nigeria is not a poor nation. If you go to countries and say go outside and say you want to borrow money and you are from Nigeria, they will look at you because individuals in Nigeria are even richer than some nations in Africa, and the resources you have in Nigeria is far, far better than what you have in even countries like Canada. But just the management is our issue. The management problem is our issue. It's the bane of our society. And I think until we address that issue, when we have bad leadership, we'll continue to wallow in this abject poverty. The Nigeria case is like a diabetic state. You know, diabetic state is regarded as poverty in the midst of plenty. You know, you have sugar floating. There's a lot of sugar. You have sugar floating around, but it cannot enter to the cell. So if we don't address it, if you don't have a revolution where we're going to have new leadership policy in this country, I think, I'm sorry, we have to just be... in fact, Nigeria has been retrogressing. We have not even been progressing. Nigeria was not like this in the 70s. In the 70s, Nigeria was ahead of even China. But where is Nigeria now? Even small African nations have overtaken us.
Quite true. Well,
so the issue of leadership is...
Leadership, yes, you're right. Very right. Leadership is key. And that's a new one on me. Nigeria as a diabetic state. I'll reflect further on that.